Want to know a common question I get asked, but have yet to talk about yet in my 7 years of PedsDocTalk? Circumcision. Before your baby is even home, you may already be hearing opinions from family, from friends, from cultural expectations, from the internet. And a lot of those opinions are loud, so let's slow this down. I'm Dr. Mona, pediatrician and mom. Today I'm walking you through the medical facts about newborn circumcision clearly, calmly, and without pressure. And if you appreciate balanced, evidence-based pediatric conversations that don't shame parents, but educate, make sure you're subscribed. Let's get into it. I get asked about circumcision constantly. In the hospital nursery, at newborn visits, in my DMs, and honestly sometimes at the park with other parents. So this video has been a long time coming. Parents are trying to sort through medical information, cultural traditions, religious practices, family opinions, and a lot of very loud internet debates. My goal here is not to tell you the decision to make. I think the decision about what someone does with their child's penis is between them and their child's penis. My goal is to walk you through the facts so you can make a decision that feels informed for your family. What is circumcision? So circumcision is the surgical removal of the foreskin, the skin that naturally covers the tip of the penis. In newborns, circumcision is usually done in the first couple of days after birth, often before leaving the hospital. One question parents often ask is, do we have to decide right away? In most cases, this isn't an emergency decision. While many hospitals offer circumcision in those first couple of days, parents can take time to ask questions, watch this video, and think through what feels right for their family. If families decide later, circumcision can still be done after the newborn period, after that first week. Another question parents often ask is it painful? In the newborn period, pain control is given during the procedure, and usually this is a sugar solution that they're given by mouth to help soothe them. If the child is older, or a teenager, or a school-age child, which I've seen circumcisions done, they can use a local numbing injection, sometimes a numbing cream, but it is not done without pain management. Healing usually takes about a week. You'll see some redness, some swelling, and very commonly a yellowish film over the area as it heals. I always warn parents about that ahead of time because it can look scary if you're not expecting it. But it's not pus. It's part of normal healing. Most babies heal without complications. But keep watching because I'll talk about how to heal for a circumcised penis and a non-circumcised penis later in this video. One other question parents sometimes ask is who actually performs the circumcision? In most hospitals, newborn circumcisions are performed by obstetricians, pediatricians, or family medicine physicians who are trained in the procedure. Reminder, not all of us know how to do them. For example, I do not know, even though I'm a pediatrician. In some situations, pediatric urologists may perform them, particularly if there are medical considerations. In certain religious communities, circumcisions may also be performed by trained religious practitioners as part of a religious ceremony. There are also a few different surgical techniques used in newborn circumcision, but the goal is the same: removal of the foreskin so the head of the penis is uncovered. Occasionally, parents notice what looks like extra skin remaining after circumcision. That can happen for a few reasons, including normal healing, swelling, or individual anatomy. In most cases, it doesn't cause problems, but if there are concerns about healing or appearance later on, that's something a pediatrician or pediatric urologist can evaluate. Now let's talk about a little historical context. Circumcision became widely practiced in the United States in the early 1900s. At that time, hygiene concerns were emphasized much more heavily, and circumcision was often promoted as a preventative health measure. But medicine evolves. Today we have modern sanitation, clean water, antibiotics, and much broader access to healthcare and education. Because of that, routine circumcision is no longer considered medically necessary for healthy newborns. Major medical organizations reflect this shift. The American Academy of Pediatrics states that while the health benefits of newborn circumcision outweighs the risks, they are not strong enough to recommend routine circumcision for all boys. And that wording is intentional. Circumcision is not required. It is not universally recommended. It is presented as an option. The emphasis is on informed parental choice. In other words, for healthy babies, this is a decision families can make based on their medical understanding, cultural values, and personal preferences. Because it's considered optional, insurance coverage can vary. Some plans treat circumcision as an elective procedure, so families often ask about coverage ahead of time to avoid unexpected costs. There are medical benefits, so let's talk about them with some context, as I always do on this channel. Circumcision lowers the risk of urinary tract infections in infancy. This finding is consistent across multiple studies. The reason is thought to be related to bacterial colonization under the foreskin in early infancy. But UTIs in healthy baby boys are already uncommon. Estimates suggest about 1% of uncircumcised infant boys may develop a UTI in the first year of life, compared with about 0.1% of circumcised boys. So circumcision lowers the risk, but we're still talking about a relatively uncommon event. Circumcision lowers the risk of certain sexually transmitted infections later in life, including HIV. Much of the strongest research on HIV comes from studies conducted in regions with very high HIV prevalence. In those settings, circumcision showed a meaningful reduction in risk. But here's the nuance. In many parts of the world, sexual health practices, condom use, testing, and access to care play a much larger role in STI prevention than circumcision status alone. There is also some research showing that circumcision can lower the risk of penile cancer. But if you're noticing a trend with the benefits, penile cancer is already rare. So yes, benefits exist. The important context is that we're often talking about reducing a risk that is already so small. We're not going from high risk to zero. We're going from low risk to a little lower. And most uncircumcised boys grow up without experiencing these problems, especially with good hygiene and safe sexual practices later in life, which are important regardless of circumcision status. In my own practice, I see an equal mix of both circumcised and uncircumcised boys. I don't see uncircumcised boys having dramatically higher rates of problems that would justify circumcision for every newborn. And if you're nodding along thinking, I needed this information, remember to subscribe. Parenting decisions deserve this kind of clarity, which I provide on this channel. So now let's talk about risk, because any surgery or procedure carries risk. With circumcision, those risks can include bleeding, infection, and in rare cases, injury to the penis. Some boys may also develop issues like adhesions during healing or a condition called meatal stenosis, which is a narrowing of the urinary opening that can sometimes occur later in childhood, affecting less than 1% of circumcised boys. Serious complications are uncommon. Most newborn circumcisions heal without major issues, but the risk is not zero. And remember, once a circumcision is done, it's permanent. And because circumcision removes tissue, it cannot be reversed. For some families, that permanence is part of the decision. I have many parents in my office who choose not to circumcise because they prefer to leave that choice to their child later in life. So if you're someone who feels the weight of irreversible decisions, it makes sense that this feels heavy. That's not dramatic, that's just honest. When parents wrestle with this, it's not because they're careless, it's because they're trying to weigh real benefits against real risks and make a choice for someone who's not them. That's thoughtful and that's reasonable. So what if you don't circumcise? Like I said, most uncircumcised boys grow up without any medical problems. Hygiene is manageable, it's not complicated, and it's not something parents need to be afraid of. In babies and young children, you should not retract the foreskin. It's not supposed to retract yet, and that's normal. You simply clean the outside like you would any other body part. Over time, often gradually through childhood, the foreskin becomes retractable on its own. When a child can comfortably retract it themselves, that's when they can gently rinse with water and return it to its normal position. There's no forcing, pushing, and no rushing. And a term I want to discuss because it's an important one is a medical term called phimosis, which refers to a foreskin that cannot retract. In babies and young children, that's common. Non-retractable foreskin in early childhood is expected. However, occasionally, toddlers and up may develop conditions like ballantitis, which is inflammation of the head of the penis, or pathological phimosis, where the foreskin becomes so tight and painful. I have treated this many times in my office, but many of these cases respond well to conservative treatments such as topical steroid ointments and proper hygiene. But if a child develops repeated ballantitis, has pain with their phimosis, pain with urination, recurrent urinary tract infections, or symptoms that don't improve with treatment, circumcision may sometimes be recommended later in childhood. Even in those situations, many foreskin-related concerns can be managed without surgery. In my clinical practice, the two most common reasons I see circumcisions performed later in childhood or adolescence are recurrent ballantitis or phimosis leading to recurrent UTIs or pain, or personal choice, meaning the adolescent decides, I want to get circumcised. But again, these situations are not common enough to warrant recommending routine circumcisions at birth. For some families, this decision is deeply rooted in religion. For others, it's cultural tradition. Some parents want their child to look like other male family members, especially dad. Others prefer to leave the foreskin intact. and allow their child to decide later. And for some families, it simply comes down to what feels most comfortable after reviewing all of this information, and these are all value-based decisions. Medical decisions do not exist in a vacuum. They often intersect with identity, culture, and family beliefs. And none of these motivations are careless. They reflect the values and priorities of each family. And there's no shaming either direction here. Circumcision also comes up in conversations about bodily autonomy and ethics. That debate is very active online and in many parenting spaces. And I think it's valid. It's that conversation of why are we doing this for our child against their autonomy, that they can decide if they want a circumcision because it's not reversible. But parents deserve clear medical information and guidance like I just provided, so they can make thoughtful decisions within their own values. So let's talk aftercare, whether you choose circumcision or not. If you choose circumcision, expect some mild redness and swelling for a few days. That's a normal part of healing. I recommend applying a small amount of petroleum jelly to the tip of the healing penis at diaper changes for the first several days with a gauze bandage on top. This helps prevent the healing skin from sticking to the diaper, which can be uncomfortable if it pulls when the diaper is removed. You may also notice a yellowish film on the tip of the penis during healing. That is healing tissue. It's part of the normal process. It's not pus. If you see pus, which looks whitish, discharge-like, that is when you should see your clinician. Some babies may seem a little fussy the first day or two. If needed, your pediatrician may recommend infant acetaminophen. Call your pediatrician if you notice significant bleeding that doesn't stop with gentle pressure, spreading redness, increasing swelling, fever, pus-like discharge, or if your baby is not urinating normally. Now, if you choose not to circumcise, the care is very simple too. No forced retraction. In babies and young children, the foreskin should not be pulled back. Just clean the outside with soap and water at bath time like you would any other body part. If you notice persistent redness, swelling, pain with urination, or unusual discharge, that's when we take a closer look. Both paths involve straightforward, manageable care. This isn't a high-maintenance decision either way. And here on PedsDocTalk, I like to just talk mom to mom to dad, mom to caregiver. Most parents aren't looking for a fight. They're looking for information. They're looking for reassurance. They want to know that they're making the right choice for their child based on the information they have. And here's the grounded truth. There isn't a morally superior decision here. Circumcision is not medically required. There are potential benefits, there are potential risks, and most healthy boys do well either way. So the goal is informed consent. It's understanding the evidence, considering your values, and choosing the path that sits best with your family. And honestly, I said this, but after looking at the information and thinking through your values, I personally don't think it's anyone else's business what you decide to do with your child's penis and their foreskin. This decision is nuanced, and every family approaches it a little differently. So here are some questions to ask yourself if you're thinking, should we do this? What aligns with our cultural or religious beliefs? How do we feel about making an irreversible decision now versus leaving that choice for later? What feels right for our family after understanding the medical information? These are the thoughtful questions. This is what thoughtful parenting looks like, and this is what my platform is all about. And if this kind of calm, grounded approach feels like a breath of fresh air, I'd love to have you here. Make sure you subscribe so we can keep having conversations like this. Bottom line, if you're looking for a medically required answer, there isn't one, because this is a personal choice. And remember, most healthy boys do really well either way if you circumcise or not. I am so glad you're here. We can have hard conversations without attacking each other, and we can trust parents to make thoughtful decisions when they have balanced information. But the only way to do that is to provide balanced information like I did here. So if you found this helpful, make sure you subscribe for more evidence-based and experience-based parenting tips and health tips. And I'd love to hear from you in the comments. Was this helpful? What questions do you have that remain? Remember, I have a team of medical experts helping me answer your questions. And just a quick note, respectful discussion is always welcome here. Harmful or attacking comments will be removed. That is the PedsDocTalk motto. Stay well, stay informed, and I'll chat with you all next time.